ICU team. This is Dave
And Duff. And we're here to talk to you real quick about a product that is not new to us, but it's new to some of our team members. And we try to make sure we answer some questions that some staff have had on this product to make sure that we're using it appropriately. And it starts out with condom catheters and correct application. So we're finding a lot of patients where it's not staying on very well. And so people have had questions about how to use them better or what other options do we have. So first off, if you're using a condom catheter, make sure that you have the correct size. We only stock smalls and mediums here in the ICU because they tend to fit better. If you need a larger size, the central supply team has those for you. But we do have a new product that was previously called ReliaFit. It is now called Men's Liberty Acute. I think if you say ReliaFit to our central supply team, they will still understand what you're looking for. So feel free to ask for this, and we're going to go over kind of when to use this and how to apply it. So the first thing I think we were discussing earlier was...
Yeah, I have a question for you, Dave.
Yeah.
How long after I pull a Foley catheter should I wait to apply one of these products?
That's a good question, Duff. So I've pulled out my Foley catheter. I want to put this on right away, or so I think, but then I've realized I've applied this device and my patient hasn't voided, and I'm going to probably have to straight cath. I'm going to have to remove this device to straight cath them. So that could be a real problem for the patient to have this on and off. This device, once it's attached, should really stay attached. So the best advice I could give would be to wait until your patient has their own independent void first, incontinent or not, and then apply this device after you know that they're not retaining any longer.
Okay, but what if the patient has is uncircumcised? What would we do then?
That's an excellent question. Whether the patient is circumcised or not does not matter. If they're circumcised, you need to make sure that you pull back the foreskin and then clean appropriately and apply still. In fact, a circumcised patient will tend to stay on better because that circumcised skin will go back over top of the device and hold it on even better.
Okay. What if they're anatomically challenged, let's say?
Okay, so especially in ICU, we see a lot of patients who have smaller anatomy, or their anatomy is actually it's actually hidden, for lack of a better term. So you're going to actually, with those patients, you're going to definitely need some assistance, and you're going to have to actually get the penis to actually come out, so by depressing down on the area around. And if the patient has a smaller anatomy, actually this device works really, really well and can attach even to smaller patients.
Okay.
All right,
Cool.
very good. So with that, we'll talk about how to apply. So first, you're going to get your package from Central Supply. You're going to tear it open. And very quickly, we'll go over the contents here and what we have available. So we have our instructions here. We'll set this aside for right now because I'm going to walk through all of this. And we have our alcohol prep pad. We have our Bio Plus, which is the sting-free barrier film, and this actually works better than I believe the old product did, and it's faster. And then we actually have the Men's Liberty Acute here as well. The other thing I would always take with me with my patients when I'm applying this is I'll take a trimmer, electric trimmer as well, to clear any hair from around the area, because if that's on there, it's going to cause issues with it sticking properly, and it just gets in your way in general. So, all right, so Duff,
shall we demo?
yes. So
Right.
Duff has our anatomy
Model
here, exactly. So we're going to utilize this as such. So first thing I'm going to do with this is I'm going to make sure my patient is properly clipped. I'm going to have cleaned with soap and water. I always find that that's the best thing to do. I don't like using the Pericare wipes because they tend to leave a little bit of a film, and it makes it harder to apply. So you can use your alcohol preps and go around and make sure that this surface is good and clean and dry. So you can give that just a second to do so. Once it's dry, then we'll be able to apply the new Bio Plus film here. It's already drying very quickly. So I would have gloves on for this procedure. I think Duff, if Duff was assisting me in this situation, he would like to have some gloves on as well.
Always.
So, and then we're going to apply.
Oh, I just ruined your whole thing. Sorry.
No way, we're going to keep you in there. We're applying this. And Jessica typically walks in when I'm doing this. So
Right.
it's kind of the norm. So just like with other, like when we're applying some sort of barrier film for central line dressings and such, you want to feel for that tackiness that you get with your gloves, not your non-gloved hands. I'm already feeling that that's happening, so I know it's dried very quickly. I can see that on the anatomy here that it is dried as well. And then we're going to go ahead and get out our flower-shaped device here. So the first thing we're going to do is remove the dressing here, leave this down below, and we're going to line this up. Okay, so let's say that we're like this. I'm going to face you guys here. We're going to line the tip of this up with the tip of the penis, apply down like so. Then we're going to push the petals down. Individually. Okay, and this is not what helps it stick at this point. This is just to get it set into position. The first one comes off here, and we're going to apply, make sure that we're lined up correctly with the base here, and come around. At this point, I'm not doing anything special, just sticking it on like so. And this is where the little trick that helps it to stick on here. We're going to remove this bandage. We're going to give it a slight pull out, and this is very easy to pull. It's not like I'm having to give it any special force. And around, and then I'm actually going to apply body warmth to this, because if I don't warm it, it will not adhere as well, and this will help it to stay on longer. So once it reaches the optimal temperature, it should stay on very well. I would like to note, I expect this to come off probably in the first shift that I've applied it. Every time I reapply one of these devices, they stick better, and I've had them stay on for days at a time. The valve at the tip here keeps urine from sitting at the tip here, so you should not have to worry about breakdown on the patient's anatomy as well. Okay, and then the next part would be, how do you take it off? So taking it off can be as simple as soap and water, warm soap and water, or you can use your alcohol prep. Let's see, I think I have the right one. This is my alcohol prep, and you just kind of work around the base here. Okay, very good. Now he's free. Cool. Okay, all right.
All right.
Well, Duff, thank you for helping me out so much with this. Any other questions that we might have forgotten with this?
No, I think we hit all the bases.
Okay, very good. All right, team. Well, good luck with using this product. We know it can help you. Thank you.
Where do you find the time to pop in my head so often? Don't you got your life to